skill I will be demonstrating is sterile, wet to dry dressing change. The very first thing that you certainly want to do is to gather all of your equipment and also to take a look at the dressing that you will be changing. And I noticed here that the person's initials and the date of when the dressing was changed last is clearly visible on the outside of the dressing. I have my equipment here, and I'm going to start first with my dressing change tray, which is a sterile tray. As you can see, I want to make sure that my expiration date has not expired, and it's certainly within the time frame that I need it to be. The other thing that I see here is some normal saline, and I've noticed that it has been opened within the 24-hour time period in which I can use it. So before I actually pour it into a container, I will be what we call lipping the normal saline. If this were a brand new bottle and never opened, I would not have to do that. But I would have to certainly put the date on it after I opened it. So the normal saline is good for a 24-hour time period. The next thing that I also have here on my tray is non-sterile gloves, and those are readily available either in the patient's room or sometimes they're located directly outside of the room. But as you know, with universal precautions, they are at various places in the facility that you will be utilizing. What I'm going to do first is actually set up my sterile field. I want to do this because as a beginning practitioner, I don't really want to remove the dressing first and expose the wound for any period of time, because in the beginning it will take you a little bit longer to set up your sterile field, and that certainly is understandable as a new practitioner. After you've become more proficient in doing the dressing change, you certainly can do it either way, either removing the dressing first and then setting up your sterile field, or vice versa. So you'll be able to determine that as you proceed in your nursing clinical experiences. So what I'm going to do now is open my dressing change tray, and as I mentioned, it is sterile, and I do want to remove the entire cover. Okay, and as I see here, I do see a garbage bag that I will be taking out to put not only the old dressing in, but anything that I will not need. So I would like to discard this, but I'm just going to lay this on the bed right now at the beginning and take my garbage bag out. Okay, and I want to step away because I want to be sure that once I've removed it, I'm not touching anything, that it remains sterile in the container. And I want to place it so that I can put what I need to as far as garbage, and I'm going to put it right up here. It's out of the way of my sterile field and the wound itself. And so I will discard the top of that tray right in that bag. And then I see that I do have sterile gloves, and I will be removing those. Remember, I can touch the outside of the package of those sterile gloves, and I need to set it down. Okay, and now it doesn't look like I have a lot of room here, so I want to make sure that when I do take my sterile drape out, that I have plenty of room to place it. So you may have to move some things around. So I'm going to make sure that this is right on the edge, all right? So the next thing that I want to do is remove my sterile drape. But as you noticed, I have been touching the outside of the sterile tray. And the reason I can is because, as you know, with the sterile field, we can touch 1 inch around the perimeter of any sterile field. And so that's why I can do this. All right, so the next thing is to take the sterile drape and take it out of the package. I do want to take a corner of it using the 1 inch leeway there. I want to step back because I don't really want the edges of the sterile drape to touch the sides of the tray. Okay, and as you can see, there's two sides to the drape. There's a shiny side and there's a duller side. Well, the shiny side is the moisture barrier side, and you always want to have that facing towards the bottom. So I want to take my drape and I want to place it. Remember, it's away from me. I don't want it so that it's going to be in my direction, and I want to make sure it's nice and flat. Now sometimes, as you notice here, this drape tore a little bit on the edge, and there's sometimes nothing you can do about it. So you just want to make sure that it's within that 1 inch leeway. If it isn't, you basically have to get another sterile drape or another kit. So the next thing would be to take my materials in my sterile tray and put them on the sterile drape. Now, in this particular scenario, I know that I'm going to need the normal saline because this is a wet to dry dressing, which is a little bit different than just a ordinary plain dry sterile dressing. So I know that I can touch this tab because with the 1 inch leeway, I'm going to take the materials here and just place it on my sterile field very carefully. And then I can take this container and I can place it on the edge. The tab part that I've been touching, I really want it away from my sterile field. I can place it here, I could place it up a little bit more, but that tab is still away from the sterile field. Or I can place it in this direction and it's facing me away from the sterile field, as well as over here on the edge. But I don't really want to go too far beyond. I don't want to be reaching over my sterile field. So I think the best place would be right here on the edge. Okay. Now, there's some other things in this particular kit that I want to also get out. These are pickups, and they look almost like tweezers. And I want to carefully just take this portion of the kit tray, because remember, I've touched the bottom of it, so this part isn't sterile, but the inside is still sterile. And I want to take it so that these edges here are not touching my sterile drape or possibly risk touching it, because a lot of students will get it at an angle. So the best way is just place it over and gently, just gently hit the bottom of it, squeeze it, and then they should come out. Now I don't need this particular tray because I have one that I can put my normal saline in. So I'm just going to take this and put it aside here. The inside, even though the inside is still sterile, the outside is not, so I can't be placing it on my sterile field. The next thing I want to do is take my normal saline. It has been used within a 24-hour period, so I want to carefully take the cap off and invert the cap like this. We don't want to put the cap down like this, because if we do that, it really is contaminating the rim of the cap, which eventually will be going back on your bottle. So we want to place the cap upright like that. Now, all the containers have a label indicating that what is in the bottle, and in this particular bottle is normal saline. Because it has been used before, we need to what we call lip the bottle. And we do this by taking the bottle and pouring a little off. But what you want to do is make sure that when you pour off the solution, that you do it away from the label, so that we don't discolor or change the label in any way where we can't read it. So I'm going to lip a little. I have my plastic garbage bag away from my label. Okay, and I'm going to pour it into my container the exact same way, because by lipping it, it's cleaning that area on the rim so that I can be assured that what I have in my sterile container is sterile. Okay, and then I can just place this back on and put my cover back on, and I have enough normal saline to proceed with my wet to dry dressing. I have my other materials on my sterile field that I will need. The next thing that I will need to do before I actually put my sterile gloves on is I will need to go to my patient and to the wound that I will be changing. As you can see, it has an air-occlusive dressing on, and just with my hands I'm going to lift up the edges of the tape, and I'm doing that without non-sterile gloves because it's very difficult to lift tape with gloves on. It's seems to not be too compatible because they will stick and you really have difficulty lifting it. So this is okay. I can lift the tape so that I can get ready to remove my dressing. Okay, and my sterile field is already set up, so I can be assured that once I remove my dressing that I can begin right away to put in a new dressing without my wound being exposed for too long. Okay, so now I would like to remove the old dressing, and in order to do that I'm going to need some non-sterile gloves. And remember, you don't want to be reaching over your sterile field, so it's important where you have your non-sterile gloves. So if you have them on the side, you may want to do something like this where they're more available. And put your sterile gloves here. Then I can just easily take these and apply them. Okay, so my dressing is basically pretty loose, and I know that there is a section of the dressing that has the wet to dried old dressing on it, and I want to make sure that I'm going to try certainly to take everything out as one unit. This may be difficult, especially if the dressing has dried out so much that it's almost dried within the tissue, so you may need to either moisten it a little bit or just tug a little bit and it should come out. And I see that it is coming out right now. And you really need to note the drainage on the dressing, the amount, the color, the consistency, and certainly if there is an odor present, because you will need to document this information in the patient's record, along with how the patient did tolerate the procedure. And certainly it is an individual thing, and it may be that prior to doing a dressing change, you need to medicate the patient for pain control, and all this information should be made available to you prior to you doing the dressing change. So I'm going to take the contaminated old dressing and actually take it in my gloved hand and remove my glove so that it's contained within the glove. And I'm going to place this in my garbage, and I don't need this glove anymore, and certainly I will remove it. Now, under ideal circumstances, it would be wonderful if you could wash your hands in between taking your old gloves off and applying sterile gloves. That is not always possible. But oftentimes what you may find available in the room is an alcohol-based hand wash that you can apply in between gloving with a non-sterile glove and sterile gloves. And if you have that available, I really do encourage you using it because it certainly satisfies hand washing in between changing your gloves. So now I'm ready to actually put my wet to dry sterile dressing into the patient's wound, and I'm going to need to apply sterile gloves. And I can touch the outside of the paper, okay, because the inside is where my sterile gloves are located. And I'm going to proceed to open this up, and there should be some diagram there that indicates the direction that your gloves are in, and I can see that they're facing in the correct direction in which I need to apply them. So I'm going to open up my paper, and usually you can do this at the same time, but I want to be careful of my sterile field that I'm not going to touch it in any way. And I see my right glove, and that's my dominant hand is my right hand, so I'm going to be applying this first. So I'm going to take my thumb and my two fingers, and I'm going to touch the area on my sterile glove that will actually be up against my skin. So I'm going to take my glove, and once again I'm going to step back because I don't want the tip of my fingers of the sterile glove to accidentally touch the edge of the tray. So I will then apply my glove. Okay, and I want to be careful down here and as you can see, I've ripped this glove, and so I cannot use this glove right at this moment. I will have to get another pair of sterile gloves, which I have right directly in back of me. So you can see why it's important to bring extra gloves with you. So I'm going to remove this and remove my gloves. I no longer can use this pair, and I will get a new pair of sterile gloves. Once again, checking the expiration date to make sure it has not expired. Now the outer part of my gloves I don't need, so I can actually just take these right out and discard this in the garbage. And these are gloves that actually tell you where the cuff is. So this says cuff end, so I know I'm in the right direction. I'm going to open this up. And this packaging actually tells you your right glove and your left glove, which is very nice. They don't always do that, but this particular package does. So I want to open this and pull this open. Once again, I'm limited for room here, but I'm going to be very careful when I open this so that it doesn't touch my sterile field. So I have to really kind of give it a little tug to keep it open. My right hand, once again, is the dominant hand, so I'm going to take my 2 fingers and my thumb and touch the area of the glove that will be up against my skin. And I actually can just let that fall down. So I'm going to step back and apply my glove. Being careful, I'm going to touch, this is what's going to be up against my skin, and that's it. Now I'm going to be applying my left glove, and so I need to remember sterile to sterile. So what I'm going to do is get my thumb out of the way. Try to keep it out of the way and just use either 2 or 3 fingers, and you want to touch the sterile portion of the glove because sterile to sterile. So you kind of want to wiggle under there. Okay, step back and apply your glove. Now, let's see. Now, as you can see, that it didn't go on as smoothly as I would have liked it, but that's okay. These things do happen. So I want to make sure, now this is sterile, and I'm just touching the sterile portion of my glove. And it looks like I'm going to really need to just relocate my fingers. Once again, just touching the sterile part. We don't want to get down here because you certainly run the risk of contaminating. So if you can get it on as much as possible, this is certainly sufficient enough. Now, what I need to do now is prepare my dressing with the solution. Now I'm going to be using these 4x4s. I will put both of them in my normal saline solution. I don't know if I will need both of them, but I will just put them in just in case. Okay. Now the one thing you need to remember with the wet to dry dressing is that you never want to put the wet dressing into the wound sopping wet. You always have to wring it out so that it's almost to the point of damp. Because what happens with the wet to dry dressing, if you put it in too wet, it will never dry. And the whole purpose of the wet to dry dressing is for debriding or cleaning the wound. So you do want it to eventually dry in the wound. And that's why I made mention when I removed the old dressing that sometimes when it dries it can stick or adhere to the wound to the point where it can be very painful for the patient. And sometimes you do need to use a little saline to actually loosen it and remove it. But by having it dry in the wound, it will really clean it and get rid of any tissue or mucus that's in there that's adhering to the edges of the wound. Okay, so let me see what I'm going to need as far as the dressing, if I will just need one. Or if I will need both. But with the wet to dry dressing, you always want to open the dressing up. Okay, we really want to place it in the wound so that we are actually adhering it in the wound, almost like as if the dressing were a piece of clay. So we're kind of need to mold it in there so we really get at the edges of the wound so that we can clean it out good. It's really referred to as wicking the wound. So you see how this dressing was once folded, now it's opened, and I kind of want to get it straightened out. And because I don't want this flopping on the skin, because if this does flop on the skin, it will contaminate it. So I want to control this dressing as much as I can. Okay, so I want to kind of wind it around my finger, and I'm going to use my pickup. Okay, you can use cotton tipped applicators as well to try to mold it into the wound. It really does depend on the size of the wound, and once you've done it, usually there's information that indicates what you need prior to the dressing change. So if I begin, I really want to come over here. Now remember, I'm sterile still. I have sterile gloves on, my dressing is sterile, and my pickup or forceps is sterile. So I'm going to start at the beginning of the wound and actually mold it in. Now, if you don't want to use your pickup and you just want to use your fingers, that's perfectly fine too, because everything is still considered sterile. And I want to be careful here when I actually put it into the wound so that it doesn't flop out. Now this is plastic that I'm doing it on, so it is quite a bit different than if it were an actual wound. So, but as do you see how I'm trying to mold it in almost as if the dressing were like a piece of clay, because you do want to get at the edges of your dressing, the edges of your wound. And you do want to try to get all those little points there, okay? So I've applied my wet to dry dressing into the wound, and then still maintaining sterility. I won't need my forceps again, so I can either put it back here or I can just drop it on my field. You can have an additional 4x4 to put over this, or you can just put a regular absorbent abdominal pad. It really depends on the amount of drainage coming from the wound, but since I have this available, I'm just going to place this over the wound. Okay, remember, sterile, which is this side, to sterile, right? I can touch the outside of my dressing, even if I didn't have sterile gloves on, because that is not against my wound. So now the next thing I need to do is to tape my dressing in place, and it's very difficult to do with gloves on. So I'm going to remove my sterile gloves. I won't need them anymore, and discard them. And I'm going to take my tape. I can go to my sterile field because I've broken actually sterile technique right at this point. I no longer have sterile gloves on. So I can take my tape, okay, and I want to apply it so that it's an air occlusive type of dressing. So I want to make sure my dressing, my top of the dressing is completely flat. And I want to make sure it's air occlusive because I don't want any possibility of any organisms getting into my wound. And this is nice to use on your patients, the paper tape, because it's a lot less painful when you have to remove it. Making sure that I provide an air occlusive type dressing, and I might even need to put one down the middle if I know that there's a possibility that this dressing may fall off. So, you know, whatever you need to do to keep this dressing on, so you may need to use a little bit more tape. Now, the other thing that I want to make sure and do is to initial and to date when I did the dressing change. If you'd like to put it, be a little bit more detailed and put the time, that's perfectly fine as well. So what I'm going to need to do is I'm just going to move this out of my way. I'm going to get a pen that I have over here, and I will put my initials and the date. And actually, I'm going to be more precise and even put the time. And I'm going to adhere it to the edge of the dressing. You never want to write on your dressing itself, just in case. the dressing is permeated with drainage, because it would not be good if the drainage and the pen meet and make contact. So you always want to put it on the edge of the dressing on your tape, just as I have done right here. Okay, and you certainly want to make sure that before you leave, you're certainly going to clean up the materials that you've used and get your patient in a comfortable position, certainly after this procedure. And so therefore, this concludes wet to dry dressing change.